Let's talk about Health Matters 9. Deputy President Professor Kithure Kindiki has blamed hiccups that have characterized the rollout of the social health scheme, popularly known as Taifa Care, on huge budgetary shortfalls occasioned by the rejection and subsequent withdrawal of the Finance Bill 2024. The Deputy President says that the financial constraints, which have led to an increase in out-of-pocket medical expenses and attracted widespread condemnation, will be fixed through the injection of additional funding through the supplementary budget. Mary Mwoki has more.
Deputy President Professor Kithure Kindiki spent the better part of Wednesday morning at the Kenyatta National Hospital, making several stops at the bedsides of a few patients admitted at the facility. Kindiki's visit was to assess the implementation and impact of SHA, as well as get patient and healthcare workers' experiences since the rollout. Professor Kindiki took cognizance of the challenges plaguing the rollout and pledged the government's commitment to resolving those issues.
We still have one or two administrative procedural hiccups, and we are consistently resolving those hiccups to make sure that Taifa Care delivers universal health coverage. So we are working very hard to make sure that this program succeeds.
The rollout has been marred by grievances from patients who complain that despite being fully paid up members, they are still required to make out-of-pocket payments for some services. Acknowledging the concern with the crippling underfunding that has hit the primary healthcare fund, the Deputy President blamed the budgetary constraints on the failure of the Finance Bill, saying the rejection of the bill occasioned huge budget shortfalls across government services. Kindiki has, however, promised that the government will source for funds to support the primary healthcare fund and save patients the agony of out-of-pocket expenditure.
We are looking at ways of if, for example, through the supplementary budget, we can, again, resources permitting, adjust a bit of resources. Even with the shortfall, we will go out of our way to continually and continuously adjust our budgets to make sure that primary health care is not left out.
Elsewhere, patients at the Mururi Medical Center in Kirinyaga were left stranded after nurses at the facility downed their tools, protesting non-payment of their salaries for over 8 months. The healthcare workers say the hospital management alleges that the salary arrears have been caused by delays with the settlement of claims by SHA. The facility is owed over 11 million shillings in unpaid claims by SHA. Mary Mwoki, Citizen TV.